Your heart is a powerful muscle working tirelessly every second of your life. It sits at the center of your chest, about the size of your fist, but its job is enormous, keeping you alive by circulating blood to every organ, tissue, and cell in your body. With each beat, your heart pumps blood and nutrients throughout your body non-stop, delivering oxygen and vital substances that your body needs to function. This constant flow is what keeps you energized, alert, and healthy. But the heart itself also needs nourishment. It relies on a network of blood vessels called coronary arteries for its own oxygen-rich blood supply. These arteries wrap around the heart, feeding it with the fuel it needs to keep beating. A heart attack, or myocardial infarction, happens when this crucial supply is suddenly blocked. This blockage stops oxygen from reaching part of the heart muscle, putting your life at risk. Without oxygen, heart muscle cells begin to die, so every minute counts. The faster you get help, the more heart muscle can be saved, and the better your chances of recovery. The main culprit is atherosclerosis, a slow, silent process where fatty deposits called plaque build up in artery walls over years, narrowing them. This buildup is often caused by unhealthy habits like poor diet, lack of exercise, smoking, and chronic stress. If the plaque's hard shell cracks, the body tries to repair it by forming a blood clot at the site. This clot can quickly grow large enough to block the already narrowed artery. In a narrowed artery, this clot can completely block blood flow, triggering a heart attack. The heart muscle beyond the blockage is suddenly starved of oxygen, and the damage begins within minutes. The affected heart muscle is starved of oxygen, and damage begins immediately. This is why chest pain, shortness of breath, or sudden discomfort should never be ignored. This process is usually the result of years of silent buildup, not a sudden event. Many people don't realize their arteries are narrowing until a heart attack strikes. Risk factors like high cholesterol, high blood pressure, diabetes, and family history can all speed up this process. That's why regular checkups and knowing your numbers are so important. The good news? We know how to prevent it. Managing cholesterol, blood pressure, and inflammation can reduce your risk. Simple changes like eating more fruits and vegetables, staying active, and quitting smoking can make a big difference. Medications can also help control risk factors when lifestyle changes aren't enough. Working with your healthcare team gives you the best chance to protect your heart. Prevention is possible. Your choices matter. Every step you take toward a healthier lifestyle helps keep your arteries clear and your heart strong. Knowledge is your best tool for a healthy heart. By understanding what causes a heart attack and how to prevent it, you can take control of your heart health and live a longer, healthier life. The classic heart attack symptom is chest pain, pressure, squeezing, or heaviness in the center of the chest. But symptoms can vary widely from person to person. Pain may spread to the arms, back, neck, jaw, or even the stomach, making it hard to pinpoint. Shortness of breath, cold sweat, nausea, or sudden fatigue are also important warning signs to watch for. Women often experience less obvious symptoms: jaw or back pain, nausea, or extreme tiredness, sometimes even without chest pain at all. These subtler signs are often mistaken for stress or indigestion, leading to dangerous delays in getting help. Imagine John, sudden chest pressure radiating down his arm, classic symptoms that are hard to ignore. Now Mary, overwhelming fatigue, nausea, and jaw pain, less typical but just as serious and life-threatening. Both could be having a heart attack, even though their symptoms look different. The key: listen to your body and trust your instincts if something feels off. If something feels seriously wrong, don't wait or second-guess yourself. Heart attacks don't always look like the movies. Quick action saves lives. Don't ignore unusual symptoms. Seek immediate medical help right away. In a heart attack, every second matters. Time is muscle. When blood flow to the heart is blocked, the clock starts ticking. The heart muscle begins to die within minutes, and the longer you wait, the more damage is done. Acting quickly can mean the difference between a full recovery and a lifetime of complications, or even death. The longer the heart is starved of blood, the more muscle dies, replaced by scar tissue that can't pump. This damage is permanent. Once heart muscle is lost, it can never be restored. Scar tissue weakens the heart's ability to pump blood, making every beat less effective. This leads to heart failure, dangerous arrhythmias, and a much higher risk of future heart attacks. People who delay treatment often face a lifetime of medication, hospital visits, and reduced quality of life. The consequences can be severe and long-lasting, affecting not just your health, but your independence and well-being. Yet many people wait, hoping symptoms will pass or fearing embarrassment. Some worry about causing a fuss, or think their pain isn't serious enough. Others are in denial, convincing themselves it's just indigestion or stress. But heart attacks don't wait for convenience, and neither should you. But waiting causes irreversible damage. Every minute lost means more heart muscle is lost, and the chances of survival drop with each passing moment. The window for effective treatment is narrow, and delays can be fatal. The average person delays 2 to 4 hours before seeking help. Far too long. This hesitation can be deadly. Recognizing the signs and acting immediately is crucial for survival and recovery. The moment you suspect a heart attack, call 911 or your local emergency number. Don't wait to see if symptoms improve. Don't try to drive yourself or ask someone else to take you. Emergency services are trained to respond quickly and start life-saving treatment on the spot. Don't drive yourself or call your doctor's office. Paramedics start treatment immediately. Oxygen, aspirin, pain relief, and defibrillation if needed. They can monitor your heart, provide critical care, and communicate with the hospital before you even arrive. They alert the hospital so a cardiac team is ready. This means that as soon as you arrive, specialists are waiting, equipment is prepared, and you get the fastest possible care. This coordination saves precious minutes and can save your life. Calling an ambulance brings the ER to you, saving precious time. The paramedics are your first line of defense, and their rapid response can make all the difference in your outcome. They'll take you to the best equipped hospital for heart emergencies, ensuring you get the specialized care you need right away. Not all hospitals are the same. Paramedics know where to go for the best results. Never hesitate. Making that call is the smartest move you can make for yourself or a loved one. Trust your instincts and act fast. Your quick decision could mean the difference between life and death. Fast action can save your life and your heart. It can also spare your family the pain of losing you or seeing you suffer long-term complications. Don't risk it. Call for help right away. Remember, when it comes to a heart attack, acting immediately is the most powerful tool you have to protect your heart and your future. The best way to fight heart attacks is to prevent them before they start. Prevention is not just a single action but a lifelong commitment to making choices that protect your heart every day. Most heart disease is linked to lifestyle, not just genetics. While family history can play a role, your daily habits have a much bigger impact than you might think. Every positive change you make can lower your risk, no matter your age or background. You have real power over your heart's health. Small steps, taken consistently, can add up to big results over time. It's about building habits that last a lifetime. Start with your plate. Eat whole, unprocessed foods, fruits, vegetables, whole grains, and lean proteins. These foods are packed with nutrients that support your heart and help keep your blood vessels healthy. Limit saturated and trans fats. Instead, choose healthy fats like those in nuts, seeds, and olive oil. These fats can help lower bad cholesterol and reduce inflammation, both of which are important for heart health. Fatty fish like salmon, mackerel, and sardines are great for your heart. They're rich in omega-3 fatty acids, which help protect against heart disease and keep your arteries flexible. Think of each healthy meal as building a shield for your heart. Every bite of nutritious food is an investment in your future well-being. Move your body regularly. Aim for at least 150 minutes of moderate exercise a week. Physical activity strengthens your heart muscle, improves circulation, and helps control weight, blood pressure, and cholesterol. Brisk walking, swimming, cycling, or dancing all count. The key is to find activities you enjoy so you'll want to keep moving. Add muscle-strengthening activities twice a week. Building muscle not only boosts your metabolism but also supports your heart and overall health. Consistency is key. Find activities you enjoy and stick with them. Invite friends or family to join you for extra motivation and support. Don't smoke, and if you do, quit. Smoking damages arteries and raises your risk of heart attack and stroke. Even a few cigarettes a day can be harmful. The moment you quit, your body starts to heal. Your blood pressure drops, your circulation improves, and your heart begins to recover from the damage. Within a year, your heart attack risk drops by half. The benefits of quitting continue to grow the longer you stay smoke-free. It's never too late to make changes. Whether you're in your 30s or your 70s, adopting healthier habits can make a real difference. Prevention is in your hands. Start today. Every step you take brings you closer to a stronger, healthier heart and a longer, more vibrant life.